Good morning. Thank you, everybody, for being here. For those who I don't know, I'm Sandro Galea. I have the great privilege of serving as the Dean of the Boston University School of Public Health that is hosting this today's symposium. I wanted to just open with a couple of words of introduction about the school and about why we are here today. The Boston University School of Public Health is one of the great schools of public health in the world. We have been in operation for 40 years. This is our 40th anniversary. And as part of our 40th anniversary, we are doing a lot of self-reflection. It's sort of, we're entering middle age. It's felt good to say, what have we done so far? What are we going to do next? And part of that self-reflection has really centered around what has been our mission, what has driven us, what gets us up in the morning, what attracts our students, our faculty, our staff, and how do we have our alumni go in the world looking at public health and our mission. And it's been very, very clear through all our conversations that issues of social justice and health equity are at the core of what animates the school and what animates each and every one of us. I frequently say that this school attracts believers, and by that I mean all of us, and I mean that as the highest possible compliment, because I think the staff, faculty, students at the school are people who want to be part of an enterprise that ultimately creates a better world, and using health as a vehicle towards creating a world that is better for our children and next generations. In the past year, we have done a strategic thinking initiative, which has engaged the entire school community, led by a committee of faculty, staff, and students. And through that, we articulated 4 principles that we feel both capture who we are and what we do, but actually inform what we want to be. And those 4 principles are as follows. Number 1, that we tackle issues that are of deep significance. Number 2 is that we do that with utmost respect for diversity, both internally and externally. Number 3, that we care deeply about health equity, that we want to strive for a world where there are no health have-nots. And number 4, that we do that in collaboration across sectors. And I can think of actually no better issue than the issue we're dealing with today that captures all 4 of those principles. We have launched a series of quarterly symposia where we bring together experts from all walks of life to tackle issues that we feel are important to the world and to public health. And this is our first one of those symposia. And we started with this one on purpose because we felt that there really could not be an issue that is deeper and closer to the purpose of the School of Public Health, why we are here and why we do what we do, than the issue of social justice, how it intersects with health around the aspects that we're talking about today. So it's really an honor to have you all here. I'm delighted that everybody could be here. I'm very much looking forward to the conversation. The good news is this is the last you're going to hear from me because deans tend to take up a lot of airtime, and it's one of my missions to try to do less of that. But before I leave the podium, I just want to make a few thank yous. I want to thank our sponsors, Santander and Barnes & Noble, who actually helped make this possible. I want to thank the folks in the Dean's office, particularly led by Catherine Ettman, who helped make this possible for the past year. Folks in communication, led by Cara Peterson, and in particular Meg Keating, without whom actually none of us would be here. And the practice office, particularly Ann Fiedler and Joanna Brown. And then most centrally, I want to thank Harold Cox. Dean Cox, who is, there he is, who is going to be your host for the day, has been the intellectual, spiritual, and logistical guiding force behind this. Dean Cox serves as our Dean of Practice and the director of our Activist Lab, which is really our outward-facing vehicle with which we engage in the world in a way as to fulfill our mission as to be a conduit for change. Since I've been at the school, it's been my extraordinary privilege and honor to work with Dean Cox. Harold.
Good morning, everyone. I'm so very glad that you are here, and it's truly amazing that this day has finally come. So I'm glad that it is here. So welcome to this conversation. I want to let you know just a couple of logistics things. If there's an emergency, there are exit doors here, the exit doors on this side as well as there is a social media lounge that is just adjacent to this room that will have both a charging station and other kinds of resources that you'll need. There's also live streaming in that room, so you won't miss anything that happens in the program. Today's conversation is a conversation about the intersection of race, criminal justice, and public health. It's a very important conversation that we are having, and it's certainly important that we're having this conversation at the beginning of Black History Month. So it's one of the offerings that our school will be doing during this very important time. We have a day of very outstanding speakers and guests who will help to share with us a number of things. And periodically through the day, we're going to take the temperature of the room, not the ambient temperature, but we're going to kind of figure out what you are thinking. So you have at your seat 3 cards. This is low tech today. I apologize for all you techie types. And you've got red, which means no. You've got green, which means yes. And you've got yellow, which means maybe. And so just to test, I want to ask you the most important question of the day. This is perhaps the most important question as we think about where we are in our country at this time, and perhaps it's the most important question that we think about for this week. So, and you're going to hold up your card and let me know what you think. The most important question. Are you going to watch the Super Bowl? Okay. Gotcha. All right. You can see, and you can get a sense then as you look around the room and getting a sense then about how the room works. So that's how the cards will work, and we'll ask you a number of questions through the day. So on a more serious note, another question. Have you ever been detained by a police or a store owner without any apparent cause? And I want you to just take a look around the room so you get a sense about the experience of the people who are in the room. The second question. I am confident that I will be given the benefit of the doubt in an encounter with the police or other figures of authority. Only one card, Judge Harris. Thank you. So it's important for us to have a sense of who's in the room and of the experience that each one of us has and the experience that each one of us brings to this particular room. All of you know that it's literally impossible for me to ever get in front of a microphone without saying something about my family, and today's no exception. I have two nephews that live in Texas, and when they come up to visit me, I become their surrogate father. And so as the surrogate father, I have learned about many things about their lives. I've learned about the kind of music they like. I've learned about their girlfriends. I've learned about where they were going to college. I've learned about their experiences as they have moved into professional careers. And I also am very aware of the kinds of things that these young men, these young black men, will experience. And if you're not aware of what I'm talking about, here are a couple examples. So when black men walk down the street, down the sidewalk, and some people see them, what do? They walk on the other side of the street. When black men walk too close to where people happen to be sitting in a car, what happens? Those people roll up the window and they lock the doors. When we hail a taxi cab, sometimes the cabs pretend that they don't see us and they speed up. These are common experiences that black men experience. And these are the kinds of things that I know that my nephews will experience as well. I'm also, I must tell you, as their surrogate father, oftentimes afraid when they go out on their own because they might get stopped by police officers. And being my nephews, I know that they will ask and they will challenge authority and they could get hurt. And that scares me a lot. I'm very concerned about that. So it is I certainly understand very up close and personally how the horror of the families of Trayvon Martin, Freddie Gray, and Michael Brown felt when they learned that their family members had been killed. I also have a real understanding and appreciation for what happens for the Black Lives Matter coalitions as they begin to think about the relationships with the police and as they ask questions about inequalities in the criminal justice system. So it's incredibly important then that the events that have happened in Ferguson and Baltimore and other places require us to ask questions about race and racism and privilege and criminal justice in this country. So that's what we're going to talk about today. This is the right question. This is the right place, and you're in the right place. So I'm glad that you're here. Our first presenter this morning is Mr. Cornell Brooks. The bio for Mr. Brooks says that he is a graduate of Head Start and Yale University. And I can only imagine that there's a story between those two parts of his life. And perhaps most important for our visit with him today is that he is the 18th president and CEO of the NAACP, the National Association for Advancement of Colored People. This organization has as its mission to ensure the political, educational, social, and economic equality of rights of all persons and to eliminate racial hatred and racial discrimination. The NAACP is the oldest, is the largest, is the most highly respected grassroots civil rights organization in our country. And the NAACP, as you know, has been on the forefront of every major civil rights issue, especially those relating to race, especially issues around eating in restaurants and voter rights and educational issues. Mr. Brooks is the right person for this job because he has also served as an advocate in a number of different settings before his NAACP job. Just before arriving at the NAACP, he served as the president of the New Jersey Institute for Social Justice. His civil rights experience also includes serving as the executive director of the Fair Housing Council of Greater Washington and as a trial attorney with the Lawyers Committee for Civil Rights Under Law. Perhaps most impressive about Mr. Brooks are two things. One, he's a Texan, and he's a graduate of Boston University. So he has come home today. Please welcome Mr. Brooks.
Good morning. I want to thank the Dean for that effusive introduction. And note parenthetically that my father was a military officer, and I was born at General William Beaumont Hospital in Texas, and lived in the state of Texas for about perhaps a year or two, which qualifies me to be a Texan as much as the younger George Bush and perhaps the White House. But I was raised in South Carolina. It is a delight to be here at Boston University, again, my alma mater. I spent my time here at the School of Theology and lived at 92 Bay State Road, and thereafter went to law school and into my career in civil rights. I want to acknowledge the leadership of the Dean, the School of Public Health, this extraordinary constellation of social justice advocates, these extraordinary panelists, and all of you who are coming together today for this important conversation and convening. I also want to acknowledge the presence, the leadership of the NAACP, who for 170 years have never walked away from a difficult fight, never backed down, never given in, never given over to the forces of injustice. I wanted to acknowledge the presence and the leadership of Juan Cofield, our state area conference president, if he is here. If you could just wave your hand. There you go. And if there are members, the rank and file of the NAACP here, I just want to acknowledge your presence and express my appreciation for your leadership. This morning, I am reminded that we are not merely in a conference room, not merely in any school of public health, but we are here at Boston University, the home, the theological home, the moral philosophical home of the Reverend Dr. Martin Luther King, Jr. Dr. King was fond of telling a story about a man who lived in a hamlet on the Hudson by the name of Rip Van Winkle. The story is told that he went up to a mountain and fell into a narcoleptic nap for 20 years. As he slumbered and slept, a great number of things happened while he was sleeping. On the way to his nap, he passed by a sign. The sign had the name of King George III. When he woke from his nap, from his sleeping and slumbering, he discovered that the sign depicted the name of George Washington, the first president of the United States. In the intervening 20 years, Rip Van Winkle slept through a revolution. We here at Boston University, we here at the School of Public Health, understand that we are in the midst of a series of revolutions. There's a revolution in the criminal justice system being waged, being carried out by people all across the length and breadth of this country. Young activists in the Black Lives Matter movement. Young activists in that multi-generational, multiracial, multi-ethnic, multi-faith organization called the NAACP. There's a revolution being carried out by people in the streets of Newark and Cleveland and Oakland and San Francisco and New York and Staten Island and indeed my hometown of Charleston. There's a revolution in the criminal justice system by those who are locked up and locked away, but also those who are waiting for those who are locked up and locked away to come home. There's a revolution. Not only in the context of prisoner reentry, but there's a revolution occurring in the context of policing. And thirdly, I'd like to suggest to you this morning that there is a burgeoning, incipient revolution in terms of the relationship between seeking justice in the context of the criminal justice system and public health. With respect to the first revolution, I have to tell you that I come to this place, to this conversation, to this convening after having spent 7 years at a little nonprofit called the New Jersey Institute for Social Justice, located in downtown Newark. Over the course of 7 years, working with the New Jersey State Conference of the NAACP, advocates, academics at Princeton and Rutgers, having spent 7 years working with hundreds and hundreds of young men and young women whose hearts were filled with ambition, moral ambitions, and professional aspirations, hundreds and hundreds of young men and young women who understood profoundly that a job is not merely a matter of work, but a matter of self-worth. not merely a matter of profit, but personhood. People who understood that a job with a criminal record was not merely a matter of dollars, but dignity. Spending 7 years understanding profoundly that the 2.2 million Americans who are locked away and locked out of sight are in fact Americans, are in fact human beings, are in fact men and women, are in fact our brothers and sisters, are in fact a representation of America as a whole, illustrative of our humanity, our dignity, our personhood as a nation, as communities, as towns, as cities, and indeed an academic community. No less, and certainly no more. In the course of those 7 years, working at the New Jersey Institute for Social Justice and working very closely with the NAACP, here's what we endeavored to do. We endeavored to make the connection between a person's well-being, their health, and their restoration, rehabilitation as a person formerly incarcerated. Here's what I mean. When a brother or sister is locked away for years on end, dumped onto the street with no ID, no medical records, no prescriptions, no ability to connect with the healthcare system that serves them well in a coordinated and thoughtful way. It's a problem not only for that man, that woman, but also their families. And so my colleagues and I pushed for and passed a set of bills that the New York Times called a model for the country. One of the things I'm most proud of was that we sought to make sure that their medical records were in fact portable. Number two, that when these citizens were released to their communities, they had the modicum of health care they had behind bars. And for some, that was the first health care they'd ever received. And so in other words, they had prescription drugs to treat the maladies of the poor: cardiovascular disease, diabetes, high blood pressure, all of the things that you see and know so much about. Thirdly, we tried to make sure that these men and women were connected with health services, that they were connected with communities and institutions that would serve them well. We understood that profoundly that it is useless, it is pointless, it is irrelevant, it is in fact insulting to talk about a person having a job when they aren't able to walk around with any minimum standard of health. And so we thought that that was critically important. We understood profoundly that this was a matter of engaging the whole of the community in that reform effort. In other words, as long as we talk about those with criminal records as the other, as somebody else someplace else, there's no coalition, there's no consensus as to bringing about sound policy. Here's a story I used to tell quite often. There was a law enforcement officer in Alabama who discovered at the bottom of a rusty file cabinet 2 sepia-tone pictures of yesteryear, 2 black and white photographs of a time gone by. One photograph depicted a young man with a precocious and ministerial bearing, and yet his picture, this black and white photograph, was scarred with the numbers 7089. 7089. The other picture depicted a somewhat older woman with a beautiful, reserved countenance, yet belying a deep, profound, fierce sense of determination. And yet her picture was defaced like the grime of graffiti on the wall with these numbers: 7053, 7053. We don't know the young man by the number 7089. We don't know the young man by his mugshot number. We don't know the young man by his criminal record number. We know him by the name of the Reverend Dr. Martin Luther King Jr. We don't know the older woman by the name, or rather by the mugshot number, by the criminal record number 7053. School children the world over know her by the name Mrs. Rosa Louise Parks. In other words, those with criminal record numbers, those with mugshot numbers are in fact our brothers and sisters. They are indeed members of our community. And as long as we talk about, as long as we discuss, as long as we engage them as the other, we cannot have sound policy with respect to the criminal injustice occurring within the criminal justice system. And so when we talk about criminal justice reform, when we talk about prisoner reentry reform, we are at an extraordinary moment in this country. We see all across the country local advocates and state-level advocates bringing about incredible progress within state legislatures. Not enough, more that needs to be done, but certainly more than our glacially moving Congress has managed to do. We are at a moment where we have the opportunity for real sentencing reform, but it means building broad, big, inclusive, sweeping coalitions. It means making thoughtful, sound fiscal arguments for reform, but it also means putting forward the moral argument, making the case that this is not about them, it's about the collective us. It's not about them, it's about who we are as a nation, who we are as an academic community, who we are as a school of public health, who we are as citizens, who we are as a nation, as Americans, and no less. It's a revolutionary moment. It's also a revolutionary moment in terms of policing. Now, may I make a biographical note? I didn't have a great deal of wise career counseling before taking on this modest set of responsibilities. Roughly a year and a half ago, I took on the responsibility of being the chief servant leader of the NAACP, which may be translated and transliterated as president and CEO, but it really means servant leader. I took the job one week, and the next week, I found myself standing before a convention hall filled with thousands of people. In the intervening time between the first day on the job and the second week on the job, a man by the name of Garner lost his life in Staten Island. He lost his life while lifting up these words that yet sting and stir the conscience. I can't breathe. He was choked out in a move that came not from MMA, but by the hands of the New York PD. Standing before this body, members of the NAACP, I found myself struggling to describe a thoughtful, smart response to what I later would call a pandemic of police misconduct. But that was just the beginning. Eric Garner, Michael Brown a few weeks later, Tamir Rice, Walter Scott, all across this country. Names we know well, names we know less, but names that we hate to call and names that we hate to see reduced to hashtags as though their humanity was reduced to 2 dimensions. But we understand as advocates, as public health professionals, this is a revolutionary moment. We have thousands, tens of thousands, hundreds of thousands, yea, even millions of Americans who've had enough. When we look at the polls in this country, it's clear that the leading non-economic issue in this nation is race among the electorate generally, the citizenry generally. But among young people, race is the #1 issue of concern. And when people talk about race, they're talking about not just the vote, not just housing, but policing. Because I don't know of an African American man in this country who's been on this planet for more than a minute who's not been detained by the police under circumstances that are constitutionally hard to describe as anything other than harassment, including yours truly. Lest you miss the point. Moments after graduating from a little school to the south of here called Yale Law School, and after clerking for the chief judge of the U.S. Court of Appeals for the Fourth Circuit, arriving in Washington as a newly minted civil rights lawyer, riding in my brand spanking new subcompact car without air conditioning or radio, unnecessary and expensive extravagances as a young lawyer. I found myself driving in front of the U.S. Capitol, not paying attention. My foot slipped off the brake at a light. I tapped the car in front of me. I get out of my car to see if the person in front of me, that their vehicle was okay and fine and I hadn't caused the accident. I had unwittingly hit an unmarked police car. Police officer gets out, directs me back into my car, then has me get back out of the car, asks for my ID. I reach for my ID, I give him my ID, then I reach for my glasses. Not a smart move. He reaches for his gun. He then asked me what I do for a living. Being somewhat apprehensive, I tell him what I do for a living and then add that I'm a civil rights lawyer. He didn't miss the point. He said, I don't give a what you are. I'm not entirely sure if my white colleagues and classmates at Yale Law School would have been subject to the same treatment. The point being here is when an African-American young man is 21 times more likely to lose his life at the hands of the police than his white counterparts, something is profoundly wrong. And when we understand that Sandra Bland was subject to being threatened with a taser because she declined to put out her cigarette and because she was too, like Ida B. Wells, an uppity black woman, she found herself behind bars and ultimately dead. If we understand that this is not merely a problem of African American men, not merely a problem of African American women, but a problem of Americans more broadly, more generally, more inclusively understood, then this is something we can take up because it is a revolutionary moment. All across this country, we have people who understand that there's something that can be done. We understand from the academic studies that policing that is carried out with community trust not only makes sense as a matter of civil liberties and civil rights, it makes sense as a matter of effective, responsible, and responsive policing. You can't carry out an investigation, can't carry out a prosecution without witnesses, without people who trust you. And the academic studies demonstrate that where people regard law enforcement as a moral authority having legitimacy, people are much more willing to obey the law. It's time for a different model and modality of policing, and the people in this room are well able to call for it, well able to demand it, and well able to get it. We have not convened a gathering of Rip Van Winkles. We have convened citizens who have a revolutionary mindset. We want best practices. We want evidence-based practices. We want social justice driven by metrics and a sense of moral vision. We want change, and we're well able to secure it. It is that moment. All across this country, we see it. How do I know it? There's a small band of social justice advocates, nearly 500,000 strong, 2,100 units in every large city and hamlet, thousands of hamlets all across the country. It's called the NAACP. After the non-indictment in Ferguson, the CEO, not being a gifted student of geography, called for a march from the home of Mike Brown to the home of the governor, 134 miles. Your CEO, again, not being a particularly gifted climatologist, calls for the march in the middle of the winter. But here's what we discovered. We discovered 75-year-old grandmothers, 7-year-old grandchildren, 17-year-old high schoolers, walking in ice storms, walking in the cold, walking through the rain, walking that we might secure justice for those who are being victimized by policing injustice. What did we discover? You can look this up online. A little town called Rosebud, Missouri. We had a sheriff who declined to provide protection for our people. The NAACP marched into a town where the people decided to engage in a robust demonstration of their First Amendment liberties. So they displayed fried chicken boxes, malt liquor bottles, Confederate flags, lest we miss the point, watermelons as well. But here's what I saw. I saw a state conference president by the name of Mary Ratliff, in her 70s, a grandmother, walking in her constitutional dignity. The point being this: in Ferguson, there was only one point of accountability. Darren Wilson got off. The Ferguson Police Department might have gotten off. But there was a pattern and practice investigation, pattern and practice report by the Justice Department. Now we have a pattern and practice settlement that will hold that police department accountable. How did that happen? It happened because of the evidence gathered from statistics mandated by a law that the NAACP wrote with the governor when he was Attorney General. Advocacy makes a difference, and we can make a difference. Third revolutionary note. This is a school of public health. We understand from the academic research that many of our citizens live in a cauldron of stress. They live in communities with epidemic levels of violence. They live in communities where people live under the threat of the police, not as protectors, but as an occupying army. And in such communities, people live with elevated levels of hypertension. They live with elevated levels of diabetes. They live with elevated levels of all the chronic maladies of the poor, driven by the communities in which they live. This is a public health challenge. This is not merely a policing challenge, not merely a criminal justice challenge, not merely a public policy challenge. It is a public health challenge and a public health threat, which is why we need your expertise, which is why we need your experience, which is why we need your insights, which is why we need you to help us explain to the rest of the country, unless we save them, we can't save us. Unless we do something about their community, we won't have a community. This is a public health conversation. Last point here. Throughout the history of the NAACP, we've used marches and demonstrations and forms of direct action to make our point. In a way, there are no Rip Van Winkles here, but there are a great many sojourners of social justice. We're all engaged in a collective march toward freedom and justice. And so if on that march you find yourself growing weary, you find yourself growing discouraged, you find yourself growing disheartened by what you see on television, read in the newspapers, see on your mobile device, may I leave you with these encouraging words from that hymn of the NAACP. Lift every voice and sing till earth and heaven ring. Ring with the harmonies of liberty. Let our rejoicing rise high as the listening skies. Let it resound loud as the rolling sea. Sing a song full of the faith that the dark past has taught us. Sing a song full of the hope that the present has brought us. Facing the rising sun of our new day begun. Let us march on, let us march on, let us march on, let us march on. Let us in this school of public health march on until victory is won. Thank you.